And as we said at the outset, we're going to make this a bipartisan effort. This is one of the most important undertakings the Finance Committee has been part of, and we thank you for your leadership. And also, focused on bipartisanship, Senator Stabenow, who for years has worked relentlessly to improve behavioral health with our colleague, Senator Blunt of Missouri, is with us. Senator Stabenow, your questions.
Well, thank you, Mr. Chairman. I just want to say thank you to you and thank you to Senator Crapo. This is so important. Spending not one hearing, but multiple hearings on mental health is absolutely critical and has not been done since I have been in the Senate. And I'm very grateful for all of your leadership. And yes, this is an area of bipartisanship where we've begun a process of changing to address healthcare above the neck the same way we address healthcare below the neck and the funding and so on. We have models that work now. We just got to move forward and get it done. And there's a lot more to do. And I want to also just give a shout out to Trace. Thank you so much. Thank you for coming forward and sharing your experience and for now being a part of really making a difference in young people's lives. And part of overcoming the stigma is all of us just telling our own story, the story of someone in our own family, so that we're treating, anxiety or mental illness the same way we would if somebody was a diabetic or had a broken leg or broken arm. That is just part of healthcare. And I hope we're going to work together and we're all going to get there. So let me, and by the way, I also wanted to say, Trace, in your written testimony, I appreciate your mentioning both our school-based health clinics that I think are the model for us in the school setting and our certified community behavioral health clinics that really are the model for quality comprehensive care in the community now that's fully funded, where professionals are fully funded so that we can move forward. So, Dr. Benson, I wanted to ask you particularly around that point because I appreciate all of our witnesses and their wonderful testimony, but our community behavioral health clinics that we now have demonstrated in 10 states fully funding what can happen if we are funding behavioral health like our FQHCs, our community health centers with high standards, full funding as healthcare, where we're seeing now the difference that can make. And we're working hard to have this be the structure across the country, really, which I believe can really transform the services we're talking about. But the CCBHCs, as we call them, really make help available where children are, and we nearly have about 25% so far of the community services being given to children, and there's a lot more that we can do. So I wonder if you might speak a little bit more. I know you discussed this in your testimony, but highlight the importance of these comprehensive community clinics, particularly on underserved communities.
Thank you so much, Senator Stabenow, for that question. The community behavioral health clinics are key components of the mental health continuum, and a significant component of the problems we face this year related to those services being overwhelmed by the number of patients and limited numbers of providers. It's vitally important to address equity for all children, to have care in their communities where they are every day, that's accessible to their families, that's culturally competent, and integrates principles of cultural humility. And in academic centers like the children's hospitals, we partner very strongly with the community centers to expand access. And so we should be able to provide and fill in the gaps where they exist in those clinics. So for example, because the reimbursement isn't always what it should be, they tend to run with a lower number of high cost providers. And it's our responsibilities in centers where there are more resources to be able to provide that support to the communities. But without a strong partnership, we'll never be able to successfully address the concerns of young people in our country.
Absolutely. I totally agree. And we can do this. We have done this on physical health. And so we absolutely can do this. I know my time is running out. Time is too short. I have many questions I will submit. I did want to also just indicate that I'm excited that to be leading the committee's working group on workforce issues, which each of you have raised and so critically important. And I'm working with Senator Daines, my colleague, on this, and we'll be reaching out to each of you to ask for your further input. So thank you, Mr. Chairman.